fairly close to him, I think. We're so happy to have Dr. Bianka Reese, who is a public health research scientist and evaluator specializing in research in health, equity, positive youth development, and maternal and child health. She's here to talk about an important topic, actually a crisis today in the United States. We had Dr. Stromer a few weeks ago on the show who talked about maternal mortality crisis among black women. And Dr. Reese is here with us this morning to further highlight this crisis, discuss what's behind the increase in deaths amongst pregnant and childbearing black women and what needs to be done to combat this problem. Welcome, Bianka, to the Sports Shop. Good morning, Bianka. How you doing?
Good morning.
Good morning. You can tell I definitely read that intro right.
Yeah.
I tell people
Great
all the time.
job.
I tell people all the time, they don't know unless you tell them.
I know. So I appreciate you making me sound like I knew what the hell I was talking about. Thank you so much.
Yeah, you did that. You did that.
But let's jump right into it. So why is that? Why do black women in particular face more health risk during pregnancy compared to other groups of women?
Well, first I, want to shout out to Dr. Stroman, who talked before me in the previous segment. Y'all are getting a lot of public health knowledge today. So I appreciate the opportunity to continue to talk about this really important public health crisis. Dr. Stroman, a couple of weeks ago, like you said, that a couple eloquently laid out the state of America's maternal health crisis, especially among black women. And this came after the very sad news of Tori Bowie's untimely death at the age of 32. And as many of your listeners probably already know, Tori Bowie was an Olympic champion in track and field, and she won a gold medal as the anchor leg on the winning 4x1 relay at the 2016 Olympics in Rio. And that was one of three medals she won. She actually also won the silver medal in the 100 dash and the bronze in the 200. And so that, I grew up running track pretty religiously.
Yep.
So I was a big fan of Tori's and was really crushed when I heard the sad news. Tori was 8 months pregnant when she passed away from complications of childbirth in her home in Florida back in May. And unfortunately, her story is just far too common in the United States. The U.S. has the highest maternal mortality rate among all high-income countries, and this crisis is only getting worse. And data shows that black women in the U.S. are three times more likely to die from pregnancy complications compared to white women. And keep in mind that these numbers are even more alarming when you consider that most of these maternal deaths are completely preventable. So this shouldn't be happening.
Wow. This is great stuff. I appreciate this conversation. We're talking to Dr. Bianka Reese, who is a public health research scientist and evaluator. I have one daughter, and it was a very high-risk pregnancy, so I definitely understand this conversation. And during that, and knowing it was high risk and the things I had to go through, Dr. Reese, and being on bed rest for 3 months, sometimes it was really hard to really, get certain things done. So I would like to ask you, so what needs to be done to improve pregnancy outcomes and really get your doctor to listen to the black woman?
Right. Well, Pam, like you just described, black women face far more health risks, at all stages of the pregnancy and after the pregnancy for a multitude of reasons. But it largely boils down to one main root cause, racism, right? Mm-hmm. So perpetual racism at multiple levels, structural, systemic, and even interpersonal racism within the healthcare setting really puts black women at a greater risk of pregnancy complications. So structural factors like the lack of adequate insurance coverage during the postpartum period, or, black women not being taken seriously when they do seek care, and especially if they're in pain. It's unfortunate that world-class athletes like Tori Bowie, who, top-notch shape, has access to healthcare resources, was not immune to the harm caused by structural racism. So saying all that, I remember hearing or watching an interview of Tori Bowie's agent, Kimberly Holate, and she spoke about how Tori had a lot of hesitations about delivering in a hospital. She didn't trust the hospital, but she wanted to, have more control over her delivery. And so it's completely unacceptable that, women of color have this perpetuating mistrust in the U.S. For our healthcare system. And so black women should have access to more quality care And that means doing things at the structural and systemic levels. Training healthcare providers just beyond, implicit bias trainings, but really calling out and dismantling these bias practices that are continuing to perpetuate these outcomes.
Wow.
There should be widespread efforts for, recruiting diverse healthcare workforce, expanding access to telehealth services and insurance coverage, and really, even in the postpartum period where a lot of these preventable deaths are occurring, extending paid parental leave, right, as a policy would offer support during this critical period. So structural and policy changes are really needed to improve these outcomes for Black women.
Right. That's where my biggest issues was in the postpartum piece.
Mm-hmm. Oh, wow. Mm-hmm.
Mm-hmm.
Outstanding. We're talking to Dr. Bianka Reese, a public health research scientist. We're talking about I would say, a critical issue in today's society and healthcare, where I guess the mortality rate for Black women during childbirth or during the childbearing years. And you talked about a couple things that we've talked about on the show a number of times is systemic racism in the other areas, and then biases in other areas. And you would think on the surface that when it came to healthcare, because as a healthcare professional, they're not actively being discriminatory toward African American women during childbirth, but it happens. And I think sometimes how do we as individuals take more responsibility at trying to be more assertive, similar to what maybe Serena Williams did, where because she had a family, of women, a large number of women in her family that was like, look, no, this needs to happen. Mm-hmm. But how do we educate ourselves and be more assertive, in those times of need, especially for our loved ones?
Well, yeah, it definitely is an education component, but I should mention that it shouldn't, the burden shouldn't rely on the pregnant person, right? Who is stressed enough, right? Her body is about to change significantly, right? So she shouldn't have to advocate for herself, nor should her family members. Mm-hmm. It should come from the healthcare setting and the providers that are working with them. And so, there are racist or just biased practices, things like, testing Black mothers for substance use when they're actually in the infant and delivery ward, right, and not testing white mothers. Those sort of biases can sort of perpetuate these outcomes, right? But you mentioned where you asked about education on our side. I think there is a huge movement right now where there's a lot more community activism and research led by community-based organizations who are working in and with Black communities to really understand and they can elevate, right, their experiences and their specific needs, specifically for Black women. So there is some hope and, meaningful progress sort of tends to be slow moving, and there's much, much more that can be done. But really keeping the public informed and educated, like you mentioned, K-Mac, about this crisis is a good way to just keep attention on this issue and hopefully drive political will and mainly money towards prevention. Black women athletes like Tori Bowie, like Allison Felix, like Serena Williams, and Black women across America, we all deserve better.
Absolutely.
Wow.
Good stuff.
I had a quick text from one of the listeners want to know, would it help if you had a Black doctor?
Absolutely, yeah. And so one of the things I mentioned for structural changes would be to help increase the diversity of the healthcare workforce. So things like collaborating with HBCUs and students there, providing things like tuition assistance for diverse scholars, or partnering or mentoring programs that can partner students with faculty of color and professionals of color in the field. Those efforts would increase the diversity of the workforce, right? Because a person would feel comfortable in this situation where, a whole lot is about to change and not have to worry about those things, right? You just want to be able to have those underlying understandings, and having a diverse workforce would hopefully help with that.
Yeah. Well, Dr. Reese, you shared some key information with us. I'll be following along with the progress of Black maternal health, the Black maternal health bill. Thank you for coming out. Thank you for writing all these questions up and the intro and the close.
Our new producer.
Is there anything else we can do?
All right. Well, let me just plug. I'm Bianka Reese, but thank you all for your time. I really am honored to be able to share this information and hope to be back on and share some more.
No,
thank you. It's been really good.
Thank you so much.
Keep the news coming.
Dr. Reese, that was good. Appreciate you.
Good stuff.
Yeah. And Zach, get your steps in, 7%.
I'm working on it.
He's sitting on 400.
Hey, look. See, Bianca, he been cheating. He over here swinging his arm.
Trying to figure out my watch.
He's trying to figure what out. He over here swinging his arm. He cheating, Bianca. I'm telling you.
Well, you stupid.
Yeah, I'm snitching.
All right, B, take
That's
care.
pretty clever. I can't lie. All right, y'all have a good one.
Thank you.
I'm snitching. What you got back there,
Wow,
A-Town?
that's good.
Miracle Touch Auto Center has a touch to get your car fully inspected and keep yourself safe on the road. Our expert mechanics will check your vehicle from top to bottom, inside and out, to ensure that it meets all necessary safety standards for the state of North Carolina. Our comprehensive services keep you safe and ensure that your car runs smoothly. Contact us today at 919-598-8833 to schedule your appointment or drop by our Durham location at 1714 East US 70 Highway. We're here to help you drive with confidence.
You know, I always think whenever we do segments and things like this, our HBCUs we gotta figure out how to put them in the forefront of a lot of this stuff.
But we got to take the
Right.
leadership in some of these things.
Yeah.
Things that affect us, we should be
That's
out
it.
front,
Right.
leading it. And I thought the same
We
thing.
gotta be out front, and we need to get funding for it and research dollars.
Yeah.
Let me help you out. Let's send it there.
Yeah, exactly.
Why am I? Okay, I was gonna say something.
Woo.
But anyway, when we come back, we're gonna talk.